Well, SuperPATH is, it stands for Supracapsular Percutaneously Assisted Total Hip, and that's a lot of words for essentially describing a way of doing hip replacement in a way that allows us to build the tools and the implants inside the human body without having to build them outside of the body and then put them in, without having to twist it in any unnatural positions. And in order to do that, it really allows you to do it in the most, arguably the most minimally invasive way possible. Compared to traditional hip replacement surgery, the SuperPATH approach is truly very minimally invasive, even compared to some of the other minimally invasive approaches it is. And this ultimately leads to less downtime for the patients after the surgery. It leads to a little easier recovery. One of the biggest things is that there are no precautions or movement restrictions to the patient afterwards. Traditional hip replacement usually has a bolster or a large pillow between the legs. Patients are usually required to avoid tying their shoes or putting socks on for fear of dislocation. And when you're saving all of those muscles, then you don't necessarily have to wait for them to heal, so the recovery time is faster. Plus, they're still there, and they're just as strong as they were before the surgery.
3 weeks from today, I had surgery, and I think the recovery is going very well. At this point right now, on the outside of my body, just where the muscles are on the outside, they're sore as if I had a long run or something like that. But where it used to hurt when I had the bad hip, inside the pain, there's no pain there anymore. We had previously seen another orthopedic surgeon here locally. This guy said I was too young to have surgery, and he prescribed injections which worked temporarily. So then when we met Dr. Chow, he looked at the x-ray and said, you need to get this thing replaced, and here's what's going to happen, and here's how fast the recovery is going to be. And you know what, he was right.
There are very few physicians currently doing this, but we hope that that number will grow as time goes on. SuperPATH in its current iteration is very, very new to the surgical community. Worldwide, there are only 5 of us doing it routinely, and of those 5 of us, only 3 of us had any real part to play in the development of the technique. The beauty of the SuperPATH approach is that it is a part of a more standard approach to to hip replacement as a whole, and to actually any work around the femur or the pelvis. So if you have an extremely complicated case, you have a very straightforward case, there's no harm in starting as a SuperPATH approach and maybe even doing selective releases. Maybe you can't spare every muscle in the body, but maybe you can spare most of them and still get a good reconstruction or an excellent reconstruction. It really is a very adjustable approach to pretty much all pathologies and all anatomies. And that's true also for overweight patients. Even a standard open total hip replacement is very difficult in the morbidly obese. And what we find, especially in my experience, is that very large patients, while it is harder to do SuperPATH, it's not as much harder to do it as a SuperPATH than it would be for a standard posterior approach, the incremental difficulty. I think that this is going to be the next biggest thing in terms of hip replacement, especially as enthusiasm grows for less invasive techniques for hip replacement.
I would recommend the SuperPATH technology to friends and to family.